I'm sure we'll have a couple more people popping on, but I think it's okay to get started so we have time.
All right, sounds good. Good afternoon, everyone. Happy New Year. The Prince George's Healthcare Action Coalition, Leslie and myself would like to welcome you to our first Food is Medicine subcommittee for 2024. We are glad that you have decided to join us again this year. And we are looking forward to all the wonderful things we'll accomplish together this year. So if you could please go ahead and introduce yourself in the chat with your name, your organization, and what interests you about Food is Medicine. And by the way, I'm Taryn Shaw, co-chair of the Food is Medicine subcommittee, along with Leslie Jefferson. I was going to say Leslie Giant. All right, let's go ahead and we can introduce ourselves in the chat. Thank you. And would you like me to do the section as well? Or?
Sure, yes, please.
Okay, so right now we're doing our welcome and introductions. If you just join us, please drop your name, organization, and what interests you about Food is Medicine in the chat. And then we'll have a produce prescription program presentation, the GUSNIP. We'll have that presentation and then a question and answer session. The floor will open for announcements and then we will adjourn.
Thanks, Taryn. And Leslie, I can pass it over to you to introduce our guest today.
Thank you so much. I am so happy to be here. My name is Leslie Jefferson. I'm the Community Health Program Manager at Giant Food, and I am very excited to kick this off today with Taryn. It's great to see everyone on the call, those whose faces I can see. And if you didn't know, we've been searching for ways to fund food as medicine initiatives with this, and it's challenging. It's challenging to fund these types of programs, and we've been working with many partners to try to apply for many different grants. But there is one that's been out there and is tried and true. It's called the GUSNIP. You may have heard of that before. If you've heard of GUSNIP, put it in the chat. And if you have questions, great, start thinking about them, because the GUSNIP is the Gus Shoemaker Nutrition Incentive Program, and it comprises many competitive grants programs, and is sponsored by the USDA. And we are really lucky today to have someone here to go over and chat with us about what it means to apply for these grants, because one of the main purposes of these grants is that it brings stakeholders together from various parts of the food and healthcare systems, and it shows a great opportunity for funding, and it's all about increasing the purchases of fruits and vegetables and produce prescriptions. And they have 3 different programs. So one is a nutrition incentive program, a produce prescription program, and they also have a technical assistance program. So today, to go over these programs with us, we have Christopher Grimes. He's PhD. So let me say Dr. Christopher Grimes. He's the National Program Leader with the USDA and the National Institutes of Food and Agriculture. And he will be presenting to us today about GUSNIP and answering questions. So I'm going to turn it right on over to Dr. Grimes.
All right. Thank you so much, you all. I hope everybody can hear me okay. Um, it is good to be with you all this afternoon and to be able to speak on behalf of the GusNIP team and to speak on behalf of NIFA for this tremendous program. Uh, I basically what I'm going to be doing today is giving an abbreviated version of our produce prescription RFA technical assistance webinar. Now that webinar, the full webinar can be seen online. There is if you Google, I don't have it in this presentation, but if you Google that on NIFA's website, you'll be able to find that very easily. Somebody might be able to even put that in the chat real quick if they find it, which would be great. And so we're going to be, that's what I'm going to be doing today, talk a little bit about primarily the produce prescription, but I also want to be able to talk a little bit about the nutrition incentive program, which that RFA is going to be coming out real soon. And so we'll be talking to you. I'm going to talk to you briefly about that. And then I also want to give you an opportunity for folks to get involved a little bit, especially with reviewing some of these proposals. And so we'll talk to you. We are always searching for individuals to volunteer to be able to review proposals in all of our different funding areas, but especially GusNIP. And oftentimes we get a lot of professors and individuals from higher education institutions that are willing to review, but we'd like to have individuals that are more intimate to the community and to those related to GusNIP. So for instance, like grocers, as long as there's not some sort of financial gain that can happen, they've got to be independent of that. But we're looking for those individuals. And so I'll share just a little bit of information about that as I get there. Just real quick about me, just so you know, like, who is this fella? I'm actually fairly new to NIFA. I've been with NIFA a little over 5 months now, but I spent the previous 14 years and some months at Kentucky State University, where I was a professor. And my background is actually biochemistry and cancer biology. But I did spend about a decade doing nutrition education programs there at the university, and I ended my tenure at the university getting more involved with bench research and things like that, and more academic type endeavors. But it has been it's been a nice shift moving over to NIFA. It was a great opportunity for me, and I'm glad I have that opportunity to take it. And so I am pleased to be able to be a part of this GusNIP team that's operating these funding programs, and that's what I want to share a little bit about today with you all. So I'm going to go ahead and share my screen, and before I do that, I'm going to turn my camera off because I am going to be looking off screen, and that will just be a little bit odd if my camera were on and you see the side of my face. So let's see here. I'm going to share my screen with you all. Okay. Give it just a second to populate there. Okay. Can everybody see my screen now?
Yeah.
Fantastic. Thank you. All right. So the Gus Schumacher Nutrition Incentive Program, this presentation covers the produce prescription program and for FY 2024. So I'm going to be referring to the 2024 RFA. And I should say that this is presented in part by the award-winning Gus Schumacher Nutrition Incentive Program team. They've won several awards. Now, I would love to take credit for some of that, but I can't because those awards were given out right before I arrived. And so, but I'm just happy to be a part of this fantastic team that's been working in this arena. So to begin, I always want to pop up this non-discrimination statement. We take this very seriously with NIFA, as we should. And so we make sure to share this whenever we're getting ready to give a public presentation, or if we are getting ready to go into panel, just to make sure that everyone knows that we try to be as absolutely unbiased as we possibly can and avoid discrimination at every cost. And so here's the information about that. If you need more information, you can find it there. As far as the Gus Schumacher Nutrition Incentive Program team, or the GusNIP team from here on out, I want to give you just a little bit of background on that. And so this is the full team. It takes a big team to make this work, and this doesn't even include our NTAE, our Technical Assistance Group. that we have that has worked real hard for us. And so here at the beginning, we have Suzanne Saluka, who is our deputy of the Institute for Food Safety and Nutrition. So she's the deputy director. Dr. Shannon Harillo is the division leader for nutrition. Of course, Mallory Cannings, which many of you all have probably spoken to or you've seen in presentations. She is a national program leader and a co-lead along with myself with GusNIP. And I will say that she is the guru of GusNIP. And so she has done a tremendous job working in this field, training me up. And so I'm very grateful for that. Sheila Fleischecker is involved with GusNIP. Of course, Ryan Cornegie and Jamila Sacazio, they are our program specialists. Beth Curling and Maria Crespo-Shishimpo are our awards management folks. Kiva Shepard is our program assistant. Stephanie Morris works with our data and statistics. And then we have our F&S colleagues, including Andrea Gold, Heather Garcia, and Julia Kaplan. And so we're just real thankful for this team that we work very hard on making this program work. And I will tell you, having had the experience of working in many different with many different grants, and from both an academic side and then also from this side, last 5 months, the Gus Schumacher program is a big program, and it takes a lot of moving parts to make it work. And this is a very strong team that we have working for you here. This is our contact information, and so I believe that this is going to be recorded so you can go back and find this. But of course, our NIFA program staff, you can reach out to any of us, and we'd be happy to answer any questions. Our F&S GusNIP team, of course, our NIFA grants management team. So if you are awarded a GusNIP award or any type of NIFA award, it is likely that you may be speaking to Beth Curling or Maria here, and they work a lot with our awards management. And then, of course, our GusNIP NTAE, our technical assistance group. We're thankful for them, and they really help us do the technical assistance with you all, for those of you who are going to be applying, as well as conducting much of the evaluation, the global evaluation, if you will, from all the programs. And so we enjoy working with them to see just how effective this program really is. Now, the topics we're going to cover over the next 20 to 25 minutes, I'm going to give you a brief NIFA overview just so that you all understand what NIFA is. There's a lot of misunderstanding of what NIFA is. Even at the university level, there are some individuals that don't really understand exactly what the role is there for NIFA. So I want to do that briefly. I want to give you a program overview of the GusNIP program. I want to look at the RFA in detail, some specific RFA details in case you're interested in applying. And then we're going to talk just briefly about the proposal evaluation process. Like, how does that happen, which is a really critical piece to this, because many of you all, as you submit your proposals, you're wondering how are those being evaluated, graded, scored, and I want you to know how that happens so that it's sort of demystified, if you will. So just a brief NIFA overview. The National Institute of Food and Agriculture is what we call the extramural science funding agency within USDA's research, education, and economics mission area. So what does that mean? It means that NIFA is responsible for the majority of the funding opportunities involved with food and agriculture within REE, or research, education, and economics. And so we deal with, we're the ones that are putting out the request for applications. We're developing those grant funding programs, working with the stakeholders, working with you all on developing these grants and getting these funded so this great work can happen. NIFA invests in and supports initiatives or programs or projects that ensure long-term viability of agriculture. And so we want to make sure that we are focusing on programs and projects that aren't just an immediate success, but actually they're sustaining successes. Of course, that ties into food security and other things as well. And NIFA provides funding and strategic leadership for programs that really look at groundbreaking or innovative, unique agriculture-related practices and technologies that can really uh, get involved into the communities out with the people throughout the country, so that they can put those things into practice. And so it's a very practical application. It's stuff that we see results with. And so just want to share that with you. Some topics that are covered by the NIFA program, and that's wide ranging, from advanced technologies to education, human sciences, to food and nutrition security. One of the interesting things that I experienced when I was in the university is that when I was teaching students from nutrition, basic nutrition, all the way to nutritional biochemistry, is that I would talk about the USDA and I would talk about NIFA and agriculture, and many of my students, their eyes kind of glazed over because immediately they went to farming, which of course we know that farming is exceptionally important, and we love our farmers and our producers. But many of them didn't necessarily have an interest in personally being involved with farming. But I wanted to make sure that they understood that these programs covered a wide gamut, much broader than just farming, but it goes everything from business to technology, economy, nutrition, all kinds of things. And so really NIFA covers a wide span of programs, and I'm very proud to be a part of that. So there's a little bit of a background about NIFA. I didn't want to go into too much detail about that, but I wanted to give you some framework to work from. Now, what I'd like to do now is go into a little bit more of the program overview, and I want to begin with the GusNIP program in general and sort of where it started. So GusNIP, it started, or it builds on the foundation of first the Healthy Incentive Pilot Program, and then also the Food Insecurity Nutrition Incentives, or FINI. So many of you might have heard of HIP or FINI, and so that's where GusNIP has its roots. But the GusNIP competitive grant programs that we now see are authorized under this legislation here, 7 USC 7517, and it began in 2019, and it has now gone. Of course, now we're in 2024, and we have the RFAs out now. And well, we will be getting both of them out. Right now, PPR is out, produce prescription, and nutrition and incentive will be out soon. But it began with about $45 million to cover the three legs of GusNIP, and now it's up to about $56 million in mandatory funding. And so this is a very high profile program. It's something that Congress really keeps an eye on. And they're very passionate about this program and what it's doing for our communities. Now, what's interesting is in 2021, the GusNIP portfolio, it received some additional funding from Congress. And the aim was to address some critical food and nutrition security needs, especially with low-income communities and individuals' households that were trying to deal with the pandemic. And that was done through the GusNIP COVID Relief and Response, or GusCRR. So you may be familiar with that, or if you run across that acronym, that's what that means. And so it was some additional funding that was infused into GusNIP to help to get more availability to these nutrition incentives. In addition to that, that was followed up by, in 2022, with the American Rescue Plan Act, or ARPA, and these funds provided additional support to GusNIP, specifically the Produce Prescription Program. And then from 2019 to 2023, GusNIP has invested over $290 million in over 230 projects. So there's a lot of work being done through this funding program. And so, speaking of food as medicine, I mean, GusNIP has a huge role to play in that. And so I'm from a health perspective and a health science perspective. I come from a College of Medicine background. This is I'm very passionate about this. Now, the three legs, this was introduced to you at the very beginning, and I want to just go into a little bit more detail. The three legs of the GusNIP program, there are three competitive grant programs. Now, the first one is the Nutrition Incentive Program. And what that does is it provides incentives to increase the purchase of fruits and vegetables by consumers. And now here's the key here: participating in FNS administered SNAP and NAP food assistance programs. So many of you all are familiar with SNAP, which is operated by FNS, or the Food Nutrition Service. Many of you all may not be familiar with NAP, or the Nutrition Assistance Program, and that's for the insular areas like Puerto Rico and places like that. But in both cases, the individuals that are participating in the nutrition incentive program, or that are benefiting from this program, they're getting incentives to purchase fruit and vegetables, and they have to qualify for either SNAP or NAP. And so I just want to put just kind of tease the nutrition incentive program, that funding opportunity. In fact, it has a very high success rate, around 70%. That RFA is going to be coming out pretty quick. And so I want to tease that a little bit to folks who either may not know about it or who weren't necessarily thinking about it, to provide that as an opportunity for folks. Now, the second one is the Produce Prescription Program, or PPR. And what it does is it leverages medical assistance programs. And we're going to talk about what that means. But what happens is healthcare providers write prescriptions for fresh fruits and vegetables. And so they're actual prescriptions that go to partnering groups, grocers, farmers markets, whatever it might be, that are partnering with the entity that's leading in this whoever gets awarded the funds. And these prescriptions go for fresh fruits and vegetables. I do want to highlight the word fresh. And so you didn't see that fresh in the nutrition incentive program. It just said fruits and vegetables. So that would be anything that is qualified by SNAP or NAP. So any fruit and vegetable that would fit within the SNAP or NAP definition is qualifies there. But within the program, within the produce prescription program, they must be fresh fruits and vegetables. So that's one caveat. One thing I will say about the PPR program: it is highly competitive. So only about 15% of entities get funded through that program. There's lots of interest in PPR. And then finally, we have the Training, Technical Assistance, Evaluation, and Information Center, and that's the NTAE, which supports potential applicants, those who have already been awarded, and then they collect and aggregate data and statistics in order to improve our practices within GusNIP. And of course, that's operated through Gretchen Swanson and through the Nutrition Hub, and that would be the NTAE, and they're an invaluable resource to help us with this. We work with them hand in hand every week, and so we're very thankful for them. So that's the GusNIP program overview right there. Now let's switch over to PPR, because that's what I was asked to really focus on today. And I'm going to move pretty quickly through here to make sure to respect your all's time. But what is new in the 2024 RFA? And you'll see the page numbers up here at the right. Number one, what's new is that it does clarify the required attendance of project directors at the annual PD meeting. Now that seems like a small thing, but it is actually quite big. Every year we have a PD meeting. It will either be in person or virtual. This past year we were in New Orleans. It was in person. It was fantastic. And every project director is required to come. And so you can put that in your budget to come for travel and all of that, but we do need to make sure that the project directors, at least the project director, is at that meeting. Two, it clarifies that the total funding for PPR must be less than or equal to $500,000. And so if it's a penny more, if the proposal is a penny more, that proposal will not be included. So it has to be $500,000 or less. Two other components that are very important also. It does clarify that institutions of higher education, or IHEs, so these would be like universities, colleges, that are local, county, tribal, territorial, or state government agencies, they must provide documentation in support of eligibility as a governmental agency. So what we recommend is that if you are applying as an institution of higher education, that before you do that, you may automatically think that you're a government agency, especially if you're a part of a state institution, but that may not be the case. So we would ask that you would send us documentation for us to look at before you go through the effort of applying, so that we can look over that information. We'll send it to policy to make sure that you are an eligible institution. Now, this goes for institutions of higher education or government agencies. It does not count for like nonprofit organizations, community organizations. That's a different thing that I'm going to discuss here in a minute. But with higher education, we want to make sure that you're actually an eligible organization. And so send that to us. If we approve that, then you can take that documentation and you'll put it in field 12 of the grant application. And finally, what's new for 24 is that the RFA clarifies that applicants and their project partner organizations, they must ensure that there is no tax collected, whether it be state, territory, or local tax, that no tax can be collected on the produce when the prescriptions are redeemed. This is important, and it must be documented in the grant application. That would be in the project narrative, or you could have a letter of support from a partner organization that says in no uncertain terms that taxes will not be collected. So that's just really important, and I want to make sure that that everybody understands that. Now, what is the purpose of the produce prescription program? Number one, it is the intersection of food and healthcare systems. And so we're trying to improve health, but we're also trying to reduce healthcare costs. And so we're improving the nutrition of individuals, and we are improving the health of participants by prescribing fresh fruits and vegetables. And again, fresh fruits and vegetables are any variety of fresh, whole, or cut fruits and vegetables. And so it can be a cut vegetable, one that's been diced and sliced, but it must be fresh and it must be whole. That's a really critical component to this. What are the goals and objectives? Number one, and this is very important because in the RFA, if you're writing an application or a grant application for this program, you'll want to address each one of these goals and objectives. And number one, it's to improve the dietary health through the increased consumption of fresh fruits and vegetables. Number two, it's to reduce individual and household food insecurity. So that's a major component, reducing food insecurity. And then three, reduce healthcare use and associated costs. And so that's why that food is medicine component is in there. We're wanting to see evidence that there is a reduction in healthcare costs and associated costs. And so we want to be able to see how that's happening and how your grant application is going to address those three objectives. And of course, there are core metrics that are measured. I mean, specific questions that we ask everyone to include in their surveys and their evaluation, so that can be measured on a whole scale across the portfolio of GusNIP. Our priorities, and so there are some specific priorities that we have been focused on. This changes from year to year, but number one, and I'm not going to list them all, but you can see them here, is there are two different sets here. Number one, underrepresented communities. We're really focusing on these underrepresented communities to make sure that we are addressing the needs of these communities, and so that they have access to more food security. And then also underrepresented geographies. We want to make sure that we are working in these areas, individuals that don't necessarily have these programs. And so we are prioritizing, if you will, these areas and these communities. Now, what is the eligibility? Now, I've already mentioned the governmental agency, but I'm going to describe it again. But number one, nonprofit organizations. If you are a nonprofit organization, you can demonstrate that through your IRS documents, then you qualify. So that's a fairly easy one. And then number two, governmental agencies. And those governmental agencies, again, if you're a higher education, you have to demonstrate that you are actually affiliated with a governmental agency through some sort of documentation. Oftentimes, that's an IRS document. And so Veterans Health Administration and various components of its healthcare system, such as hospitals or clinics, are also eligible governmental agencies. And I've already mentioned about the institution of higher education. And so just make sure before you go to all that effort that that you are an eligible entity, because it would be a shame that you go to all this effort, you submit your application, and then you discover that you weren't eligible, and that would be a shame. And so we want to make sure that that fits, and that is within the authorized legislation. In addition, you must have a required healthcare. There is a requirement for it to having a healthcare partner. Now, what is a healthcare partner? Here are the four definitions, or the four examples. Number one, a hospital. So that seems very simple, fairly straightforward. Number two, a federally qualified health center. Three, a hospital or clinic operated by the Secretary of Veterans Affairs. And number four, a healthcare provider group, an organized group of 5 or more persons or places licensed to give healthcare. So the ability to give healthcare. Now, there have been times when I have received an email from an institution saying that we are a small community, or we're a part of a community that doesn't have access to one of these four things, but they have access to, like, for instance, like cooperative extension that might have like a health education program or something like that. Does that qualify? And my email response kindly is, if it doesn't fit within one of these four, then it wouldn't count, and likely the cooperative extension would not count. And so you have to have a healthcare partner that is defined under one of these four categories. What about as far as a lead applicant and a required healthcare partner? Can a healthcare organization also be the lead applicant? And the answer is yes, they can. So a healthcare partner can be the lead applicant. It's not the most common thing, but it does happen. It does happen. We see that. And so so that is possible, just as long as it's a nonprofit organization, a government agency, and a healthcare partner that can provide health services. That would all qualify. And all of that is defined in the RFA on pages 15 and 16. Now, what are the grant basics here? I'm sort of keeping time here to make sure that I'm not running over. What are the grant basics? Number one, the program name is the program prescription program. The code is PPR. The maximum budget is $500,000. You can ask for less. You cannot ask for more. The project duration is up to 3 years. You can operate for less, but we don't go over. It is possible, for whatever reason, if you need to go over 3 years, like if you've had challenges with your program, or if there's been things that have come up that require that you were not able to fulfill the objectives in 3 years, you can always ask for a no-cost extension. But the maximum duration at the front end is 3 years. And then projects must prescribe fresh fruits and vegetables, evaluate fruit and vegetable intake and dietary health, food insecurity, as well as healthcare use and associated costs. And so those are the grant basics. Now, what is the description? You must include one of the following. You can include more, but you have to include at least one of these. That you're going to provide financial or non-financial incentives for eligible individuals to purchase or procure fresh fruits and vegetables, and or provide educational resources on nutrition to eligible individuals, or establish additional accessible locations for eligible individuals to procure fresh fruits and vegetables. So all of this is a part of that. All right. Okay. Now, who are the eligible individuals? Like, who are the ones that can actually participate or receive benefits? Individuals who are eligible are folks that are managing or who are at risk of developing a diet-related health condition. And so if an individual were to, they're managing it through a physician's guidance, or they are at risk according to a physician. All right. And they are at risk of developing a diet-related health condition. and either they have to be one of these two, eligible for benefits under the Food and Nutrition Act of 2028 or of 2008, or they're enrolled in medical assistance under a state plan or waiver, like for instance, like for instance, Social Security Act, and that sort of thing. And so they have to be one of those two. They have to be eligible for the Nutrition Act or enrolled in medical assistance. In order to qualify for this program, you must have a healthcare partner letter of support. And so that's really important. So that's going to be a part of your application. You won't want to leave without that. You won't want to apply without that because your application won't be accepted. So you must have a letter of support from a healthcare partner. If you are the healthcare partner, you still want to put that letter of support in there. It must explain the role of the organization, including all the activities that that organization is going to conduct as they are participating in this project. They're, for instance, like refer potential participants, screen, verify eligibility, track health outcomes, provide education, communicate locations at where prescriptions may be redeemed, collect core participant information and metrics, and then evaluate individuals participating in the program. So all of these things are different activities that the healthcare organization may participate in. In addition to a letter of support from a healthcare organization, you also must have a letter of support from the NTAE. Now, this is really crucial. If you're so the produce prescription RFA, or the application for this granting opportunity, is on February 28th. So February 28th is when this is due. Before then, every applicant is required to have a consultation session with the GusNIP NTA Center. And that is a free group session or one-on-one support. And what that does is it helps organizations avoid common mistakes that are made. And so that's a really important thing. So you have to have a verification or a document stating that you have gone through that 1-hour consultation with the NTAE Center. And that's and it's invaluable. It's something that you'll want to do anyway to make sure that you're participating, that you understand everything about this application process. In addition, there is a requirement for comprehensive evaluation. And so, number one, it is a requirement to participate. We have to have that. So evaluation is a key component. So you'll want to make sure that you have to have a robust explanation of what your evaluation is in your grant application. I mean, make that a real prioritize that in your application, in your narrative. You're gonna be required to collect a minimum core data set, and so there are specific metrics that are required, and you'll need to collect those, and you'll find out what those are. You can see information about that in the RFA. You can also see information about that through the NTAE at their Nutrition Hub website. You can find out all that information. You must collaborate with the NTAE on the collection of this evaluation information, and then you have to contribute this minimum core data set to the NTAE. So there's a minimum amount of data that is very explicit, what has to be collected and then what has to be contributed to the NTAE. You can collect more, you can find out more information, but there is a minimum amount of information that has to be collected in order to be eligible to be funded through this program. Now, just very quickly, in just a few slides, I'm going to talk just about some application details and documents, so that you're aware of this. NIFA only accepts electronic submission of applications, and so if we get an application with a stamp on it, it won't be accepted. And so there's a very specific way that you go through in order to submit your application. NIFA grant application, the NIFA grant application guide is available at grants.gov. And a SAM unique entity identifier is now required in place of a DUNS number. And so if you need information about that, the grants.gov application guide will help you through that. But every entity must have that information. So it involves, it's a security issue, it's a financial issue, and you can receive that number. Application documents must be in a portable document format. So every document that is uploaded in grants.gov must be a PDF. If you submit a Word document, it will not count, it will not be accepted. So it must be a PDF, and that includes your narrative and your budget justification. So it does it, and this is an important thing. Grants.gov may allow other formats like a Word document or a JPEG, but NIFA does not. We do not accept that. And also please do not use any third-party PDF builders, because that back-end code won't be recognized. And so we need to make sure that everything is specifically PDF. What are the application details? This is kind of the nitty-gritty stuff. This is the stuff that I had an outline on when I was working at the university. For every grant I was writing, I had a document pinned up above my desk with all the details here so that I made sure I didn't miss anything. Application details, field 8, that's the big field. It is the project narrative. That's the big portion of your grant application. There is a 15-page limit. You can have 1.5 spacing, 12 point Times New Roman. It's very specific, and that is for so that we're not discriminating against any group. And so, for instance, in order to reach that 15-page limit, when I was in college, I'd try to increase that font a little bit or something like that. Well, here you might be trying to get more information in 15 pages. So you might try to reduce it like to 9 or 10 font, where you have to have a little magnifying glass to read it all. It has to be very specific. 1.5 spacing, 12 points Times New Roman. Written text, figures, and tables must be within 1 inch margins, 1 page response to previous review. Now, what does that mean? If you have already applied to the produce to GusNIP, the PPR funding opportunity, and you were not funded, then but you got reviewer scores or reviewer comments, you have an opportunity to resubmit your project, and you get 1 extra page as part of your project narrative to respond to the previous year's reviewer comments. And so instead of 15 pages, you get a 16th page in order to answer or respond to the reviewer comments, which is very helpful. And that will help either clarify things that were confusing or demonstrate the changes that you've made in order to address some of the critiques. And so that's a very valuable resource. We highly recommend people use that extra page. Field 9 is a bibliography and a reference, that's the references that are cited. Field 12 is a logic model. So we want to make sure that you have a logic model. It can be no more than 1 page. You need to have a business plan in field 12, no more than 5 pages. A data management plan, no more than 2 pages. And then also in field 12, that's where you're going to put your letters of support, no more than 2 pages from every organization. But you must have healthcare partners and GusNIP NTAE Center letters of support. You can have more than 2 letters of support, but you must have at least those 2, and every one of them cannot be more than 2 pages. So that's really critical. If you have questions about, like, for instance, a logic model or data management plan, maybe you've never done those, on the USDA website, there are examples of what those look like. I believe even the NTAE has examples of what those look like and what we're aiming for there. The project narrative will be an introduction to communities involved in the project and the benefit to the community. So tell us who's going to be participating, who your target audience is, and what the benefit's going to be. You're going to be explaining to us who the personnel and the resources of the organizations, share with us, who's going to be operating the program, what are the backgrounds of those individuals, do you have the capacity to be able to operate this program with these funds. You're going to share with us your project goals, the intended outcomes, the relationship to GusNIP PPR purpose and priorities, making sure that everything is in alignment. You're going to share with us your activities and how you're going to achieve those goals. And then number 5, like I mentioned, it's a big priority, is evaluation. And this must include, and it's in bold here, must include the GusNIP comprehensive program evaluation, core participant level, and firm level metrics. And so that's going to be standard across the board. So every application is going to have that. We want to know how this project is going to be sustainable. Number 6, we want to make sure that your sustainability program isn't just reapplying to more grant funds, but you have sustainability built in. Of course, you can reapply after being funded. You can apply for more funds and things like that. But we want to make sure that there's more than just grant funding that is something that you're looking at. And then non-supplantation. What does that mean? That this is not to replace current activities, but it must be new and or expanding on or enhancing current projects. So we don't want you funding something that's already happening. This is something new and fresh that you're doing here. How are these things going to be evaluated? I'm going to move a little bit quicker now. The initial screening for eligible organizations, page length requirements, all of these things. We're going to be looking at whether everything's in a PDF. We're going to be making sure that the budget is within the dollar ceiling, that you have the letters of support that are required, that you have the capacity to participate, that you have the evaluation requirements. We're going to be looking at all that kind of just sort of basic information. Do you have everything that the RFA is requesting? The second thing that we're going to do is that if you have all that stuff, then your application is going to go onto a peer-reviewed panel. So a group of your peers that are not participating in the program are going to be evaluating all of these grant applications and all the narratives. They're going to be reading through them, and they're going to be scoring them in a very unbiased way. And so that's called our panel review. And then finally, if the applicant has received USDA grant awards in the past, then the history of compliance with grant requirements is also going to be considered. And so we're going to be looking at reporting, we're going to be looking at technical reports, financial reports, and federal financial reports. So that's another evaluation that we're going to see to make sure that if you've received funds in the past, that you've always been very diligent and efficient in sending in all the required information in the post-award management section of the grant. We want to make sure that you're going to be responsible with the funds that the federal government provides. So the peer review process, the proposals are assigned. You might want to how are those reviewed? Well, the proposals are assigned for review to at least 3 reviewers with expertise. And so these aren't just random individuals. They have expertise in this area. So at least 3 people are going to review the project. Reviewers are going to produce individual reviews of each proposal. They're going to evaluate the strengths and the weaknesses. They're going to write those down. They're going to put them in our peer review system. Then these written reviews are going to be used to start off these panel discussions with other reviewers that are on the panel. And through these discussions, peer review panelists are going to come to a consensus on the final rating and ranking of proposals. And then we rank all these proposals in order of best to need some work. We'll put it that way on there to know who we're going to fund in that grant cycle. Here is the evaluation criteria. We're going to be do they focus on underrepresented geographies or communities? Do you have the ability to serve those areas? What are the benefits to the community, the goals, objectives, outcomes? All of these things are going to be evaluated by the panel. And so you'll want to make sure that you hit on all of these. I should also say that if you are resubmitting your project to the funding opportunity, you do get that extra page, but it is a new contest. So it's a new panel, it's a new contest. You don't start where you were evaluated or ranked before and then like move up the ladder. It's fresh. The only thing that you do get is that extra page. Here are some common mistakes to avoid. Number one, make sure that you meet all the format requirements that I listed before, especially the PDF documents. Make sure to complete and submit all the following documents here that's listed in this presentation, from a budget justification all the way to the letters of support, bibliography, current and pending, and conflict of interest. Make sure that you submit all of those things. You do need to submit the proof of eligibility, especially for higher education organizations. Review the budget to make sure you're not over, and be attentive to the due date. If you are 1 minute over the due date, if you're a second over the time, then that will not it will not be accepted. So make sure you submit your grant application in early. The timeline, 1 to 3 months for competitive programs. The RFA is going to be released, proposal writing, and then the proposal due. That's the first 3 months. The second and third month, that's the proposal under review, proposal funding notifications, and then 1 to 2 months, awards are finalized and made. And so on average, it takes between 6 and 9 months from the point that the RFA is released to an award being made to an organization. So this is not something that's quick. It takes some time. And so just be patient, and we'll keep you updated on what's happening. And finally, the last thing I want to say before I take questions is we want to make sure that if you are interested in being a reviewer, and especially like I mentioned before, we want to tease this, that we are really looking for individuals who are grocers, that are involved in grocery stores, companies, organizations, things like that. We want to make sure that we're trying to get more of those individuals to be a part of this peer review process. But if you're interested in being a reviewer, you can register at this website and put in all your information, and then we go through that website in order to select reviewers. And I will tell you, there is nothing that is more educational than being a reviewer of these programs to figure out how to write one of these grants. And so I did that when I was in academia. I would be a reviewer for a grant program, and that would help me understand the mentality of the reviewing panel so that I knew how I would actually be able to write a grant in the future. So that is the presentation. I'm going to stop sharing, and I will entertain any questions that you might have.
Woo!
I'm sorry, that was a lot of information, I know.
Claps to you for being able to present it in the way that you did. I mean, very, very comprehensive. But I'm going to ask, on the site also, is nutrition incentives also spelled out as nicely as you've spelled out the produce prescription programming?
It will be. So just so everybody will know, the RFA has not been announced yet for the nutrition incentive. It will be announced very soon. We're still going through some back end stuff to get that out. When that's announced, also there will be an announcement for a webinar, just like we did for PPR. So there will be a webinar. These slides, or slides similar to this, will be available on the website. And of course, if you need myself or Mallory or someone else that knows this program to be able to share information, we can do that. But that webinar is a very useful tool. And that's always recorded. So if you missed the webinar, you can go online and watch the whole recording. It's actually being translated into Spanish as well. So yeah, Kimberly, you have a question?
Hi, yes, thank you so much for the presentation. My question is there a minimum requirement for the number of participants that we need to enroll? And then kind of a follow-up question, does a participant still count as enrolled if they initiate the program but are lost to accrual for any reason?
Right. So in order, we typically, and I'm the number, it's listed on NTA's website. And so the exact number that they're looking for evaluations, I believe is 150. That's what they're looking for. They're looking for at least 150, and that's to involve statistics and all of that stuff to make sure that we have, because if you only have 20 participants, it's very difficult to get a statistically reliable number there. And so I believe the number is 150 that they're looking for, but their website, the NTA, can share a little bit more information about that. And as far as whether or not I think what they're looking for is that final number. And so if you have some people that rotate out, like they begin and then they rotate out, I think what they're looking for is just to have that final number, if I'm not mistaken. So, but the NTA during that 1 hour consultation, that's why it's real important to get that consultation in as early as you can. And that website, I think it's on, let me see here real quick. Yes, it's right here. I'm going to share my screen real quick just so you all can see that again. Whoops, wrong one, wrong screen. I have many screens up, folks. It's this email right here, ta@nutritionincentivehub.org. So I'm going to put that in the chat real quick so that you all have that. But you can email that email right there, and that will get you lined up with a register for a consulting opportunity. That presentation went a little longer than I was expecting, so I'm sorry
Okay.
about that. There's a lot of information.
Yeah, I have one question, and might be not, maybe it's just my understanding, but the 15-page limit,
Yes.
is that in total with all of the documents, or is it just about your program? The 15 pages is just about your program as you describe it.
So that's the project narrative, okay? And the
Project
RFA is
narrative.
that project narrative, so it's very specific. And so when you go into the grants.gov application, I can't tell you how many times I've done this for myself, and so this is very fresh for me. Is that when you look at the application on grants.gov, there are very specific places to insert these documents. Like the project narrative is field 8. And then I can't remember which field is the budget justification, but all of those are very specific. And so, but yeah, it's 15 pages. And what that's going to include, it's your background, your community's target audience, your objectives. It's the overarching big stuff, your capacity to be able to operate, your evaluation criteria, all of that stuff. And then the logic model, the budget narrative, all that stuff would be separate. Those are separate documents that you're going to be describing. But again, the RFA is very explicit in what that is, and even the application itself, where you're including that information, is pretty explicit. Just make sure it's all PDF. That's what's crucial there.
I have a couple of questions on behalf of Michelle. One of the questions was, what considerations do you have towards serving patient populations who do not meet the eligibility criteria of receiving SNAP or Medicaid? So such as asset limited, income constrained. It sounds like there's probably no flexibility there, but we also were just curious if mixed status households would potentially be considered, like if their children are receiving Medicaid or SNAP benefits.
So the way it works is, it's an individual basis. It's on an individual basis. And so like if an the individual participant, if they are eligible based on the criteria that I shared, then they would count as a participant. And so I think that's about as specific as I can get there. So yeah, that's how that would work. And so if you have if you have a community, like I live in a community that's very mixed. That we have we have multiple schools in my small town, and we have some that are free and reduced lunch. We have some that are not. But even in the school system that's not, there are students there that they would fit within that demographic, or their parents and that sort of thing. So it's very individually based.
Okay. One somewhat related question to that was they found in the pilot that the food was often spread across the household and may have resulted in behavior changes for the whole family. But it sounds like it's at the individual level, but we wanted to consider a graduated incentive where an additional household members could receive an added amount. So if you had a family size of 1, it would be this amount. If you had a family size of 4, it might be a different amount. So just wanted to hear any impressions on that.
Yeah, I do know that there has been some discussion about that. And I wish I had a better I won't be able to answer that real well, just because I don't have the history of the program. But I do know that there was some discussion. What I would say is that if that's something that you're concerned with, number one, you can set up an individual call with myself and Mallory. Just shoot me an email. We'll schedule a time. We can talk about it. Or that is absolutely, the NTA will have had experience with that. And so they'll be able to share that very specific information with you in that consultation about how that works out. Because again, nutrition incentive and PPR are two different programs and how those function. And I'm still learning myself some of the details. Like even today, I found out something this morning. I was like, well, isn't that a good thing I asked that question this morning right before my presentation? So
I don't want to take over completely. Does anyone else have any questions?
No, if Michelle has more questions that she wants you to ask, we might as well ask them.
Okay, I'll keep chugging along then. I have a couple more.
Okay.
Are there any benefits to expanding the service area to multiple jurisdictions, or do you think a more focused approach is ideal?
That goes, I think in that case, we have both things happening. We have organizations that have like multiple areas that are being served, and we have some that are smaller. It kind of depends on the community. So if you're an organization that is serving a small community, then you might expand it to outside communities in order to get the participant level up, or to just make bigger impact. Or if you're in, let's say Chicago, there's not necessarily, I mean, you can stay in one like little zip code right there and get more than enough participants. So really, what it really goes, do you have the capacity to meet, can you demonstrate the capacity to meet those goals, those objectives with that community that you have? And so is it realistic? So for instance, if you're a small organization, but you're wanting to reach, 1,000 people, can you demonstrate that you have the capacity and the funding to do that? Maybe, maybe not. But also, if you have a very large organization, but you're reaching a very small group of individuals, all of those things are going to be looked at in the evaluation to see, because what the reviewers are also very concerned about, they want to know, number one, is your project going to be effective for the community? Is it going to make a dent in the community? Are there going to be really good outcomes? And to go in with, and also with that, they want to make sure the project's successful. They want to make sure that whoever they fund is going to be successful. And so that's what you have to, when I tell folks, whenever I've been asked, how do you write a grant and all that, and I've written several myself. When you write a grant, you're talking about telling a story, and you're wanting to convince the reviewers that this story you're telling is, number one, a great story, a worthwhile story to read, and a worthwhile story to implement. That's what you're trying to do there.
Okay, great. And then just the last question here is, if there are applications from different partners from the same jurisdiction, is USDA likely to only select one of those, or would there be a consideration for the size of the population or any subpopulations?
Right. So every organization is as long as they have a separate identification number, they're considered separately. So they're taken on their own merits completely. And so we're not going to compare. We would never compare if you had two organizations in the same city that are applying. We're not going to compare them against one another. We're going to look at each application individually. And in fact, if one of the reviewers said, "Hey, this one's very similar to," we stop that immediately. It has to be taken separately. We're very concerned about that. And the reviewers are very good. They are coached before they go into the review panel, what is allowable, what's appropriate, to make sure that there's no bias as we go in there. So, but we do want to make sure that each organization, we don't want duplicate submissions. So one organization, one application. That's what's really crucial.
Thank you so much.
Mm-hmm.
Thank you very much. This has been fantastic. Are there any other questions out there? Feel free. We got the expert in the room. Any questions? Once? Twice? All right. Thank you very, very much for joining us today. We're a small but mighty group, and we're trying to do some good work right here in the Washington, D.C., Maryland, Virginia area. So we know that you guys, I know you're not right in our backyard, but your offices are right in our backyard.
Right.
And we appreciate you taking the time to meet with us and share this wonderful information. Because sometimes when you're online and you're reading, it just kind of, it doesn't, but to hear you speak it it means a lot. So thank you so much for joining us today.
Oh, we have one more. It looks like
We have a question?
Yes, I have a question. I was just,
Oh,
we're talking about one organization, one application. Can organizations join together? So a healthcare, I feel like it's a yes.
yes,
And,
yeah.
yeah.
In fact, that's what typically happens. What typically will happen is that you'll have like one community organization. It could be a farmer's market. It could be an community education center, whatever it might be. They partner with a healthcare organization, and maybe they partner with somebody else. I don't know, a church or some other that may have a huge component of participants, but there's multiple organizations that partner together on one grant application. So yeah, but there is one organization that typically is the lead, and then the other organizations are partnering in there either as subcontract, subawardees, or just as participants as part of this group. But just have to make sure that they're eligible organizations, nonprofit or government agency.
Okay, yes.
One of those two.
And the average number of, what would be the sweet number for number of organizations collaborating, or is there a sweet number?
I don't know that there is a specific number. Typically what I've seen is, two to three organizations. Now what you'll end up having is you'll have a lead organization that's writing the grant. They have a healthcare organization that they're partnering with for the healthcare component. And then they have these produce partners that are actually going to be the vendors, if you will. So that's how that would work. So you might have one to four different vendors or organizations where the participants are going to go to get the produce. So like, for instance, if I could say it this way, a community center is the one that's organizing the writing it, developing it. They point their participants to one healthcare provider that are going to get the prescription. And then those participants are then going to go with their incentive or their coupon to the grocers, whoever that might be, that's part of the program. And then they're going to get their produce from from those organizations. So that's how that would work. And so, and I think it depends upon your community. Some communities have multiple organizations, like produce providers, that would be available. In my community, there's not that many, In fact, in my community, it would have to be likely a farmer's market that would participate, because everything else that we have here are big box stores. And they're not going to participate most likely in that. And so, so that's what I would suggest there.
All right, thank you.
Uh-huh.
All right. Well, thank you everyone for joining. Thank you, Kim, for putting the agenda together and getting everything. Thank you, Taryn. Appreciate everyone that's been on the call. Any final words, Taryn?
Thank you, Christopher, for being here with us. Thank you, everyone, for attending, and we'll see you at our next meeting.
Bye, everyone.
Bye.
Thank you. Bye.
Bye, everyone.
Well, if I can, what about our announcements?